here.
That's nice, you know.
Oh, yeah. Where they're trying to.
There's always someone.
That's not good. You can run around here, but it's young. That's what he got.
No, I know. That's right. We need to get like a box.
I wonder if it's because of them saying that they can
Just keep them up here somewhere.
serve for other reasons.
Yeah.
Did
you get it again?
Feel like it's
Yeah.
like the city of
I think it's arrested one. And if you just.
That's the whole thing.
You guys, I mean, are you guys fueling that fire?
I
don't know what it's about.
He ready to be this morning, I just walked away.
He actually was
You're not
out,
gonna take.
he actually was out the one that was against it, I just told him.
Against what?
You won't even call me to talk about it. I mean, tear it up. Really? You would? Did you see that? Oh, yeah.
Does he like him? He sprays it or what?
Oh, yeah, that's it.
Yeah, that's it. Okay. Yes, sir.
I guess.
We have a lot of.
Why are y'all hiding behind the pole over there? Sherry, and who goes there beside Sherry? Carter. Why y'all hiding behind the pole? I can't see.
What's that, man?
I said, why are you and Sherry hiding behind the pole? I can't see.
Well, that's where she said.
Another day. Leadership as an attack virtual. But I like to interact.
Yeah.
Yeah, I'm gonna be boring. All right, it is 10 o'clock and we will call to order the administrative meeting for January 21st, 2021. 1/21/2021. Say that real fast. Glad you all that are here could be here today. We have a short agenda and then we want to have a discussion and then we'll see if anyone else has anything for the agenda. Any announcements? It's a short week, as you all know, we were closed on Monday. And reopened on Tuesday, obviously. We had inauguration of our new president yesterday. Went smooth, no major catastrophes, thank the Lord. Any other announcements of anything going on that I can't think of or that you all are aware of in your districts or in the community? Nothing? Okay. COVID has got us all depressed and downtrodden. All right, we'll move on to the regular agenda then. The first item is a request to award ACCA joint county bid for a rubber tire roller. As you all are aware, we are the awarding authority for the joint county bid for the state. We awarded this when we awarded all of the bids, but the dealer that was the bidder is no longer a dealer for the piece of equipment. I believe I said all that right. Y'all understand what I just said. So we have to award it to another vendor. So that's why it's back on our agenda. Any questions about that? I don't know that I can answer them, but you're welcome to ask. If you have questions, we can ask the ACCA between now and Monday, but that is why this is on the agenda.
Chairman, the contracts, a lot of the leadership had the case is
They're no longer having contracts with Case International because they're pulling it out from them, so that's probably why we're seeing that here.
Case is doing that
Case is
universally?
doing Yes, sir.
Really?
So,
Didn't know that. All right. Any objection to adding that to the agenda? Okay. Item number 2 is a request to authorize finance agreement for budgeted item at Road and Bridge. Mr. Chief Administrative Officer.
Yes, we sent out bid requests to our usual customers for financing opportunities. And we received the lowest bid from, I think it's in your packet, we received the lowest bid from a new provider, and the rate is very aggressive. There were several bids, the rate came in at just under 1.5% for the Komatsu excavator. It was from Trustmark. We did get other bids in, but Trustmark was the lowest.
Great. Mark, are they have a local office or anything, or are they just like
I think they're
like Hancock was?
I think they're out of Montgomery.
All right, any questions? Are there any questions or objections to adding this to the agenda? Item number 3 is a request to award bid for 2 2021 chassis crew cab. Okay. To the lowest bidder being expected. That would be Bonnie's. Any questions for Engineer Kirkland or Mr. Cook? I guess this is primarily for Mark. Any questions or comments? Any objections to adding it to the agenda?
No objections.
All right, item number 4 is a request to award bid for herbicides. Aren't herbicides on the county bid now? And you compare these to that and all those kind of things?
Yes, we, state has a bid, we have a bid, the county has a bid, we buy from wherever's cheapest on all of it.
So we bid it and then we pick wherever.
Yes. Yes.
Any questions or any objections to adding all this to all these bids, herbicide bids to the agenda? Okay. Item number 5 is a request to approve bid for sign materials and sign faces. Same scenario, I think.
Yes, sir.
Questions or comments? Or objections to adding this to the agenda? Easy day. All right, anything else from the commission to be considered for the agenda?
Talk about, possibility of opening the unions back up.
Yeah, that was gonna, as you know, we've been operating under restrictive guidelines for our meetings for quite a while, I guess. I don't remember when we went to this type of operation, but and we have been saying since about November, we hope to go back to normal operation next month, and have not. The numbers that we have had have certainly not been good, and honestly, the plan that we were going to, or the plan at this point is to continue as we are probably through March, based on what I'm hearing from medical folks and those kind of things. The governor speaking today at 11, of course, what she has to say doesn't have anything to do with our meetings, but I just, I want us to talk about it, but the plan, we originally talked about going through January, talking to, administratively the folks. I just don't think that we are ready to open this meeting back up, based on where the numbers are. We have access to our meetings. People can watch the meetings. People can certainly submit comments to the meetings. Most all the boards I'm on now are still, save a couple, are still, going virtual. ACCA, Sarcoa, Chamber yesterday was virtual, Bank Board this morning was virtual. Most all, everybody is still using virtual. We have a webinar every other week with the 2 hospitals and the health department in the city, and they are all imploring everyone to avoid contact if possible. I just think until the vaccines are out and about and have some time to take an effect, that we need to continue to give everyone an opportunity to come to our meeting if they have something before us, but just to open the meeting up and expose these people that we require to come to the meeting to anybody that wants to come in is not a prudent thing to do. But, we are certainly, we want to talk about it today and see what the wishes of the commission are. I have asked Sherry to come, and I want you to, if you will, come and let us know I don't think a lot of people realize the impact that COVID has actually had on the county. Pull that up. And I wanted Sherry to come and kind of give us a briefing, if you will, on what has really transpired, so that we know, when we open up our meeting and bring people in, that we are really impacting potentially our employees. So I asked her to come and give us an update so we have that background to make decisions.
Okay. So good morning, everybody. I'm delighted that you've asked me to see you guys and give you a report today. And I do think some of you will be surprised at how this last year has impacted Houston County and our employees. When I've been asked to speak to you publicly in the past, I've never had a written statement. I've always come up here and just talked. I feel like that this has impacted us so much that I did make a written statement because I wanted to make sure that I didn't forget anything I wanted to say. So the last time I saw you guys was March 19th, 2020, when we had our emergency meeting to stop in-person transactions. So I have only been in this building, I think, 3 times in the last year. Everything else I have been able to do to serve our employees and do our job has been virtual as well. And we can run payroll from home. We're doing W-2s from home right now. I am still in the building. We do have some employees that have had to work from home. So it's impacted everybody. Since the time that happened, we have worked relentlessly to make sure workplace protocols were in place to protect our employees. We've worked to educate ourselves on CDC guidelines, symptoms of the virus, quarantine periods, changing CDC guidelines, whatever we can do to gain more information in a constantly changing environment. We've had people calling, where can I get tested? I'm positive, what now? My child is sick, what do I do? School is closed, what do I do? My mother's in the hospital dying, please pray for our family. We've had employees on ventilators, we prayed with their families. We've not had a single day without COVID in the last year. I've answered calls every holiday since March. Got a call at 5 o'clock on Christmas Eve when I'm sitting down with my family. Got 2 calls on Christmas Day. It just never ends. We also shut down certain departments that had hot spots where we felt like if there was an outbreak and we needed to shut them down to give everybody time to get well, to stop the spread. So if our employees are affected this way, you can bet the community is exponentially. The Personnel Board has given me the authority to protect our employees, and we are continuing to limit access in our building. We have stopped in-person transactions still. If somebody needs to fill out retirement paperwork or do things like that, we make an appointment and do those by appointment only. We've been able to fully serve the employees for whatever needs that they've had, and limit in-person transactions. I prepared some numbers for you, and I understand the pressures that you guys have, and I respect those that you have to open meetings, but now is not the time. Although our numbers are only a number as one unit, it is indicative of what's going on in the community. COVID is not under control, and I just don't feel like it would be prudent to give into the pressures of a few people to put everybody else at risk in this building. We have been too conservative and tried too hard to take care of our employees to let random people in. If they do not have business in this building, they should not be in this building. So we're all living under a new normal. We've had to adjust, our employees have had to adjust, you guys have had to adjust, and they need to adjust as well. So I pulled some numbers for you. Total cases that we've tracked, you can see, are 299. That's 71% of our staff. We've had 176 tested, 76 positive, 100 negative, and employees quarantined for other reasons. And I put those other reasons at the bottom. Some have been primary exposure, living with a positive family member, schools closed, minor child sick, travel restrictions. A lot of people were probably positive before we even had testing available. So I know 2 or 3 that I'm fairly certain had it before testing was even available. So you can add another case this morning. So it's 300 this morning. It changes every day. We wait on Monday mornings for the phones to start ringing, but I mean, they ring all weekend anyway. You can see I broke it down by month, March through January today. And, well, it's 35 today. So I think the numbers speak for themselves. But, it's not going down, it's going up. We're fortunate today with only 10 open cases. And that's the lowest I can remember it being on any given day. We have 14 to 25 people on the spreadsheet every day.
What does cases track mean?
That means an employee has been impacted. They're living with
a family member.
They're living with a positive, they're sick themselves, they have symptoms.
So that doesn't mean they have.
No, we are not letting them come to work.
Right.
For whatever reason, and we're tracking them, whatever their quarantine period is, according to CDC.
So if they've taken a family member to the doctor in the car and they tested positive, then.
Yeah.
And
we track that and we say, you can't be in the workplace.
Well, I appreciate the numbers, that's what I wanted, I didn't know if the commission knew and the other knew the impact that it had on our staff, and I want to say publicly on you personally, I mean, I will tell you all, I have talked to Sherry many times. I will tell you some of those times she's been in tears, and not just for the things that have been going on, but for the personal feelings for the people that have been sick and in the hospital and whatnot. So you are to be commended for the effort you put in for the last year. Don't get all emotional. I see you.
We got people in the hospital right now.
I know. So I say all that, I don't mean to get all messy, but I say all that to say, I absolutely want us to open these meetings back up as soon as we can. I just don't, this is me, I mean, I've had stuff, and you know, some of you have, and some of you have had loved ones. I just don't, in my heart of hearts, believe that it's time. I think even if you want to set a hard time, if you just, I mean, I don't know how we do that, but if you want to say, like I said, I was going to say, let's run through March. If you want to say we'll open in April, you know, I'll give into that. I just think we need some time to give the vaccine time to be out there and get through the community. And I know Alabama's been really slow to get the vaccine out. I mean, has anybody in this room had the vaccine?
My mom and dad had it Monday, and my daughter is in
I
healthcare.
mean, nobody, you had it because you're a Matt, nobody in this room has had the vaccine. I mean, that's.
And I didn't get it for 3 months from November when I had it, so.
Yeah, if you've had it in the last 90
The last
days, you have to
90
wait.
days, you got COVID, you can't get the vaccine, so I can't get it.
I didn't know that. So it's a slow process, even, I mean, you know, I'm saying March, trying to be, you know, optimistic and trying to, you know, trying to give into people that want to come to the meeting, but just because people want to come to the meeting, to me, this is just Mark, is not a reason to put all of these people that we require to come to our meeting at risk. I mean, those of you that come, how do y'all feel about it? I mean, right now. Mark can shake his head, but
I know our workforce has been impacted by this greatly, and there's as many people with it now as there has been the whole time. So I don't even know why we would think about opening up right now, to be honest with you. But I mean, I don't know what else to say. It's just my opinion. But our workforce, our vendors, we've got garbage trucks that's been ordered for what, 2 years? They're not going to be here till April now.
2 years?
Yes, they were supposed to be here last August. Now it's April. I mean, we had a low boy.
What budget were they in?
We had a lowboy trailer that got pushed from August. We just got it last month. I mean, everybody is impacted by this. So,
Well, there's no doubt about that. I mean, I guess you got to be sure we're focusing on people walking through that door and sitting down. Even
that's how it spreads.
Yeah, I know.
I mean,
Even with a mask on it.
Yeah.
I just think another couple or so months. Other than a couple, there hasn't been a lot of complaining to me. Now, if you commissioners have heard a lot of complaining that I haven't, then, you know, we all need to hear that. But I just, you know, we're on Zoom like everybody else is doing. You know, the Alabama legislature is going to be, we met with them the other day. They're not letting anybody come. They're Zooming their sessions. I mean, it's what everybody is doing. We're not doing anything out of the ordinary. We're being accessible. People are able to do, and most people understand why we're doing it. Most people do. And I promise to those of you that may be watching or that may be recorded, we want to open our meetings back up. We want to meet with the public. We want to go back to not having all this yellow tape. But we've got I think we've got to protect our employees and the public that use this building, and there's just not, I don't think, a reason to change what we're doing yet until we see the numbers go down, until we see that Houston County is not on the high risk list. I mean, my church is not meeting because this right here is orange or whatever color. So that's just my position, and I'll defer to you all, and I know you got some comments, and Commissioner Harvey, so whoever wants to go first is welcome to talk about it, and we'll decide what we want to do.
Thank you, Mr. Chairman. I appreciate the opportunity to have this discussion. Appreciate you getting the numbers to us about this. I guess, I know we have a couple of people that are adamant they want to get in this building. And those are the only two people that I know of that are so excited about coming to a county commission meeting for whatever reason. You know, at the same time, you know, the city of Dothan has allowed people to come to their meetings for some time now. When I sit up here and I look out there and I see all those empty seats, I'm not saying we need to open it up so that an unlimited number of people, you know, can come to our meeting. I don't think that's going to happen anyway. But even if we restricted it to 4 or 5 or 6, I don't think the risk to the employees is really going to go up that much, because we could have 4 or 5 fewer or more people randomly come in every day. So, but that all being said, this is not a hill I'm prepared for, and it's not a hill I'm going to die. I don't feel that strongly about it. But I do feel like we need to open up the meetings as soon as possible, and whether we can set a hard deadline, I would be in favor of doing that. You know, we can always push it back, just that we can show the people that we do want people to be allowed to come to meetings and watch what we do next week. So, but I'm glad to hear everybody else's comments, and as always, whatever the commission wants to do, I'm good with that.
Yeah, you mentioned the city, and they've got a monitor, you've been, you know, out in the hall, out of the, whatever you call it, outside the foyer, and they let people come in, and that would be fine if we had somewhere. I told Sherry maybe we could let everybody come over to her conference room and sit and watch our meeting, and she didn't like that either. But we just don't have you know, obviously our foyer is not, you know, where we could set that up, but, and I hate to say it, but other than a couple, we just don't have a lot of folks come to our meeting anyway. I mean, for whatever reason, even on our Zoom, we have very few people to watch, and I'm sure it's because you guys do such a good job. People are just very satisfied, you know, with what the actions we take. But anyway, if we could, I mean, I'd like us to, you know, perfect world, we just wait until we decide, but if we could, a minimum, set up some hard deadline out there that we review when we get closer, and, you know, that would be good in, you know, the end of March or something. But others, Curtis, Commissioner Harvey, sorry.
Sheriff, I do commend you on your comments. I could feel your passion for not only personnel, but just for people in general. I think that it is so important that we not be pressured by the public to open our meeting back up. This is a very, very serious matter that we've been dealing with. Even though we're hearing vaccine, everything's gonna be better, things are really not getting better. Numbers are getting worse, and I don't know what that is attributed to. I really feel like setting a hard date, I think you're being optimistic, but you're giving people at the same time kind of a false hope that things don't go that way. It's just my personal opinion on that. Mark, you spoke on churches a while ago, and our church, we have over a year doing everything through Zoom. Is so unintimate, if that's a word. It's just not the same anymore. Things are not the same. People are not the same. And you can never feel the burden of COVID-19 unless you have truly been affected by it. I have family members been affected, died, friends died every single day, every week. There's a funeral that I'm going to. I'm so tired of going to funerals everyone's world is different. You know, COVID affects everyone different. I've seen some people catch it in the quarantine 14 days, and some people catch it and never recover from it. I think that we have to keep in mind and not put our county at risk. Even a meeting like this, even though we don't have an attendance great, we never know who's carrying it even now. You never know who's catching it. You never know when you're gonna come up positive. You know, but I can tell you it is not anything to be played with. I really think I had a case of back in June. I was down 15 whole days. I'm not just saying this. I was in the bed, could not get out of bed. Sick as a dog, to the point I didn't know what was going to happen. You know, I really didn't. It was scary. I lost about 25, 30 pounds during that time, and it's just the grace of God and His mercy. I know that I recovered from whatever it was. Someone said it was pneumonia. I was tested. They said it wasn't positive. One doctor said he think it was COVID pneumonia. But whatever the case be, you know, I'm glad for that recovery. I'm glad to see other people recovering from it. But everyone doesn't. And I think we need to really, really think about this. You're saying open the doors to the public. Who are we really opening the doors for? You have to really, really understand that this is basically our meeting all the time, unless we have some people on the agenda doing some big items. And I think those people really, truly understand, at least everyone that I've talked to, what we're doing and taking all those precautionary measures. But again, that's my 1 cent.
Further comment? Commissioner Steele?
One, Chairman, thank you. And this dialogue is certainly important with the matters that we're facing with COVID and the people we know, and it seems like it's affected everybody in some way or the other. But I would like to just let our constituents know that there are some issues out there and people have some concerns possibly going on in their particular area or community. And I would encourage every commissioner to be available. Let them know what your phone number is, your email, any concerns that they have. Communicate with us, contact us, and let us work together to bring those up and try to plan out and work through some of those. Maybe since they can't be here and we're having to continue this Zoom work we're doing here, but also be available to people when they call you, so you can talk to them and answer their questions, and hopefully, you know, bring those issues up and resolve as needed as we possibly can to come forward. Thank you, Chairman.
Yeah, we put our agenda out on Facebook along with the Zoom link and on our website, and I was sending it to your predecessor, and I need to send it to you to help get the word out. But yeah, we want people that are interested to have access to our meeting. We by no means are trying to keep anyone from access, viewing, submitting comments, questions, anything like that. You know, we want to make it as easy as possible, but you know, we certainly are not the Lone Ranger either in protecting citizens and board members. And like I said, the Alabama legislature has adopted, what did they say? They're Zooming. You have to make an appointment now to go see them when they go in session. And
It's just a sentence over the house rooms are allowed.
oh yeah, that's right. They're not at all. That's right, because there's so many of them. And then the actual sessions are Zoom, just like we're doing. I mean, we all know what's going on in Washington as far as access. I mean, it's just the world we're living in, and we all pray that it gets better, and we hope it gets better. And you know, I just want to be sure everybody understands this is not aimed at anybody. You're trying to keep anybody's rights from being. We're not trying to violate anybody's rights. This is simply a policy we have in place due to COVID, and we're all as accessible as we can be, and what Mr. Steele said is absolutely accurate. So, Mr. Mayor, you got any comments?
Yes, sir.
Okay. All right. Well, what we will do is kind of a middle of the road then, if you all are okay, is we will continue as we are. And we will have this discussion again at the admin meeting, the last meeting in March, and make a determination then what we want to do beginning in April. Okay, we'll keep this through the end of March, and then we'll make a note to have it on the, y'all help me remember now, but, you know, we'll have it as a discussion, not as an agenda item, but as a discussion item, just like this, on the admin meeting, the last meeting in March. All right? Anything else?
Chairman, I just
Yes, sir.
add Gary one thing with,
Yep.
with the, volume of people that come through, and this being a public building and many people that we're having coming in to take transactions, are our employees feeling comfortable with that interaction with, if they continue to come in? I know we're following all the guidelines and the masks and the social distance. How's our employees here?
I think that's kind of an opinion question, but she of all people would have the best purview to answer that as opinion, because she's dealing with them.
I think that they're a whole lot more comfortable now than when we first opened up. I had some conversations with Chief Clerk Helms yesterday or the day before, and we talked about the plexiglass thing and the driver's license and the tagline and all that. And so I do think for the most part that most all of our employees are comfortable. There's always, you know, there's a risk factor in waiting on the public and letting who you're letting in those doors, but through the health assessments and the screening and the temperatures and the workplace changes that we've made, I think that number one, they realize we've done all we can do.
That's right.
And that they're much more comfortable than they were when we first opened up.
And let me say too, I mentioned Sherry and the tremendous job she's done. Since we're taking it here and talking about this, I really want to commend those deputies down there for the job they've done. They have at times gone out of their way, and they've been faced with things that nobody knew what they were going to be faced with, and you would pass on to them our appreciation for that. I mean, I know it's their job and they're getting paid and all that, but they've been, we really appreciate what they're doing down there with COVID, with security and protection. They have really done a good job, along with those probate clerks that are actually outside that wall of defense, if you will, that are actually the first face that people
For screening,
yeah, that are outside the building.
what business do you have here?
Yes, that's right. So it's a different world and different, but I think things have gone relatively smoothly. Most of the comments I've heard about doing business in this building anyway have been good, and I just appreciate probate and revenue and all the electeds and the employees and you and everybody that's done a good job.
Well, I witnessed that when I come in this morning, they were screening. Obviously, they had a man and woman role, let one of them come in, but extremely polite, there's no issues. Okay, I'll go let the car. I think he was kind of excited about that. But I did have a question. So I know we've had some problems in Road and Bridge, with employee to employee transmission. Do we know of any instances where we've had public to employee transmission or suspected that you could think of?
It's so hard to say because I could be exposed in the grocery store, so we don't know which public did it, you know? I don't think there have been hot spots in some of the departments I put on there for you, but most of those have been, we don't know where it came from.
Yeah.
I know there have been gatherings that created hotspots, gatherings of, gatherings where there were potentially some employees that then, those kind of things have happened. And I don't know if you call that public, or there were other people, non-employees, things like that have just happened over the year. And we just,
I don't think you can measure or you don't know who came in the building and if I got it at the grocery store. So I don't think that's just one thing we can't trace. We've traced a lot.
Well, and we continue to remind everyone to wear your mask, social distance, wash your hands and sanitize and all of those things. And the interesting thing that I had not thought of on our last conference call, I think I've told y'all many times, we have this conference call every other Wednesday. After you get the vaccine, the concern now is that people are gonna think they're now Superman or women.
Invincible.
You need to continue to wear your mask and social distance and all that after you get your vaccine, they're being told, because, you know, somebody's don't know what's gonna happen until it happens.
So it
So,
seems to catch anyone vaccine.
They're still not even sure how long it lasts
Oh, that's
either. I
right.
mean,
That's right.
we hope it's an annual vaccine, but it could only be 6 months. I mean, and you don't know when you're,
anyway, it's just so much unknown. And of course, you know, our president yesterday, somebody helped me with what he asked for a mandatory 100.
It's a 100-day challenge for the accreditation, but it's mandatory on any federal property.
Mandatory masks on any federal property and a 100-day challenge to wear masks. But I mean, we're all being asked to mask anyway, so that's, yeah. You know, it's funny, and I don't mean to really, you know, draw this out, but you go to the grocery stores and most everybody has on. But you go in a dang restaurant or a bar or something and nobody has on. So I don't get the mindset of that, but anyway, not that I don't use bars. Any additional questions? All right, here, adjourn until Monday.
Guilty. Guilty.
let's say everybody laugh.
I'm at,
Ask you when it's hot, and then it gets better.
Yeah, Trustmark. It's a bank entity out of Montgomery. They've been on our list. I mean, we send out, requests for bids to about 15 people religiously on any one of these items. And they just came up
yeah, good.
top. Yeah.
Well, they got a good rate there.
Yes, sir.
You doing better, maybe?
It's live.
Did anything turn out on the meeting into the COVID-19?
Yes, everything worked out. Commissioner Herring is taking the lead. There was like 5 guys in the office yesterday, and they would drew pictures on my whiteboard. You can come take a look at it if you want. And Commissioner Herring is going to take the lead in